Natural urges, Vega. The Ayurvedic texts describe various kinds of natural bodily urges. They are called Vega. These natural urges should neither be suppressed nor forced as they express the naturally occurring needs of the body. Restricting or forcing them affects the natural movements of Vata, which can lead to problems that might not be obviously related at first glance. Let us consider the most common urges, Vegas, and the implications of interfering with them. Flatus gas. This is eliminated through the anus. Some gas is natural and indicates proper digestion. In some people, there is more than a normal amount of gas. Sometimes it may smell bad, which means there is indigestion and needs treatment. The best thing to do in this situation is to eat a light diet for a few days and take recommended Ayurvedic digestive herbs. As strange as it may seem, suppressing gas causes various kinds of diseases, including anxiety, heart diseases, and diseases of the eyes. It is observed that sprouted beans, potatoes, or some lentil dishes, irregularly timed meals, excess quantity of food, health foods, and even stress increases gas. So, it is best to avoid these, but suppression of the urge should be avoided. Bowel movement is normal once or twice a day. One should neither suppress the urge to have a bowel movement nor should one initiate it forcefully. It is not uncommon that the urge vague for a bowel movement is ignored or not noticed due to absorption in work or the unavailability of a toilet or for some other reason. This can give rise to headaches, cramps in the legs, even heart disease or poor eyesight. Long-standing constipation is found to be root cause of many diseases, including heart disease and various kinds of pain. Relieving constipation and the obstruction of flatus brings relief in many cases. I was treating a case of cancer of the lower end of the esophagus, and stomach in a 60-year-old woman. She had metastasis in her lungs, left humerus and right femur. She could neither sit nor sleep and was in a great deal of pain when brought to my clinic. I could feel the hard stools accumulated in her large intestine on examination of the abdomen. She was admitted to an Ayurvedic hospital and an enema treatment basti was started. Once she passed the hard stools, the pain reduced and within a week she was much more comfortable and could sleep without any analgesics. She got relief from the pain just by relieving the constipation. So this natural urge should never be suppressed. There is another example in which a patient was suffering from an inguinal hernia. He had a strange habit of forcing the elimination every time he went to pass gas or urine. Do you really pass stool every time? My guru, Vaidya asked him and then he said, mostly not, but at least gas gets released. He was forcefully trying to evacuate the bowel and that was the cause of his hernia. He gave up this habit and his hernia healed. Urination. Every person has to fulfill this urge from 3 to 4 times to 7 to 8 times a day. Frequency depends on the quantity of liquid intake, especially water, nature of work, and atmospheric conditions that do or do not produce sweating, and also psychological factors. Depending on various causes such as preoccupation with work, inconvenience of bathrooms, etc., the urge is suppressed. This again leads to a deranged state of vata dosh and to diseases of the urinary tract, especially renal calculus, as well as the same symptoms as mentioned above results from the separation of gas and stool. We found a typical case of a man suffering from cancer of the urinary bladder. He was a salesman in a cloth shop, which was air conditioned. He used to offer cold drinks or hot beverages like tea or coffee to the customers and also used to drink them himself. Due to air conditioning, there was no chance to sweat and he could not go for urination very frequently because of the large number of customers. So he suppressed this urge many times in a day for many years. Finally, he developed cancer of urinary bladder and he was advised to have his bladder removed as the disease had invaded the nearby muscles. We successfully treated this case with a kind of enema delivered directly into the bladder and some other medication. He was able to keep his bladder instead of sacrificing it and became disease free. Thirst. Whenever there is a real need of water, it is felt as thirst. Ideally, one should drink water only when one feels thirsty and then only enough to satisfy the thirst. We should never gulp but should sip water. Many of us do not know that the sensation of thirst is experienced on the upper palate, and when we gulp water, we do not satisfy the urge, but keep drinking unnecessary extra water which might not be good for digestion. There is a popular misconception that drinking water in excessive quantities is good for the body. Many people drink excess water out of habit. This habit actually gives rise to an increase of kapha dosh and hampers digestion. According to Ayurveda, water also needs to go through digestion, just like food. Hunger and thirst are natural urges to allow the natural demand and supply mechanism for food and water. So they should be consumed only as required. Many times excess thirst might be a sign of imbalance which needs to be fixed. Reducing the intake of water is even recommended as a treatment in conditions where there is excess kapha dosh. Excess water consumption can lead to diseases caused by kapha dosh, including swelling of the body, sinusitis, bronchitis, etc. I came across a saint many years back who was very thin and weak. His weight had ranged between 65 and 70 pounds for the last 4 years. He was able to consume only a small amount of rice, 1 ounce uncooked, and moong dal, green gram, a third of an ounce, cooked. He performed a kind of religious fasting with only one meal per day and that without any oil or ghee for 145 days continuously. With a walk of 10 to 12 miles a day, followed by religious teachings of 1 hour duration. As a consequence, he lost almost half his weight and became very weak. I could see that he was very thirsty and constantly drank water throughout the day, amounting to 4 quarts a day. I advised him to boil water with a special kind of rice flakes, laja, and drink it in sips and asked him to drink goat milk as per appetite besides rice and dal. This worked like magic. He reduced his water intake to 1 quart of water a day and he started consuming 1 quart of milk every day and there was a weight gain of 10 lbs in 1 month. Here we see that it is important to notice whether thirst is a natural urge, a disease or imbalance, Trishna Roga, or just a desire to drink out of habit, Pipasa, in order to properly address or treat or manage. Hunger. Hunger is felt whenever the body requires nourishment and the previous food is digested. Hunger is often suppressed due to busy work schedules, unavailability of food, dieting or any other impediments which can cause weakness and in long term can lead to loss of weight and strength. In situations where a normal meal time has been missed and there is hunger, it is best to eat a small quantity of food which is hot and includes ghee and oil. Snigdha. The quantity should be reduced because the digestive power is weaker due to unavailability of food from the missed meal time. Often there is false hunger due to desiring a particular food item. The temptation of a favorite food can lead to a feeling of hunger which is not really there. This is why it is best not to have readily available snacks at the office or at home to avoid temptation. Real hunger can be judged when a person is ready to eat foods which one does not normally like. Sleep. When the body requires rest and the senses do not want to take in any more stimulation, a person feels sleepy. Due to heavy work schedules or late night entertainment, this urge is suppressed. Lack of sleep leads to body aches and mental haziness. People may feel lazy and experience heaviness in the body. Children are good at following this natural urge. When they feel tired, they sleep in whatever situation they find themselves. Unfortunately, adults often feel there are things that are more important than sleep. Vaidya BP Nanal was treating a case of insomnia which had been going on for 22 years. The patient was given a treatment of warm oil poured over the head, Shirobasti, and immediately after the treatment he slept for 36 hours continuously. Sleep is one of the most important pillars of life and should never be neglected. Coughing is an urge that properly try to suppress is an urge that people try to suppress, especially during meetings. However, suppressing it just increases it and the person has to suffer more. So it is better to avoid suppressing cough. Tears. Grief or sorrow is expressed through crying and a person gets relief when tears come. But these sentiments or feelings are often suppressed. It is important to identify these cases. This may lead to pain in the eyes, head, or even lead to a tumor. Generally, it is difficult to identify these cases, but an expert can diagnose them through symptoms and patient history. Sometimes the loss of a very beloved person is so shocking that the person is unable to express the feelings. In these instances, counseling and sleep help release the emotions. Use of medicinal wine, asav and arishta is sometimes also recommended to help the person. Nausea and vomiting. Whenever the body feels it does not want to retain something in the stomach, which could be food, kapha or pitta dosh, it tries to expel it out by vomiting. This is not a comfortable process and many people resist it, leading to all sorts of problems. People with hyperacidity often have nausea and they get relieved after vomiting. Many people try to suppress this urge with the help of antacids and they can become a victim of skin diseases. It is never advisable to suppress vomiting, either by force or by medications. Rather, medicated vomiting, vamana, is the treatment in these cases. During pregnancy, many women take medicines to stop the nausea and vomiting, which is not a good idea at all with 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 of thinking the disher. Sexual urge. This is an important urge, especially in young people. There are different norms in different societies about the ideal age for a safe and healthy sexual life. At an earlier time in India, the age for marriage was much younger and provided young people with a safe and reliable outlet for their sexual desires. Now, the many years required for the completion of education and the establishment of careers delay the age for marriage. As a consequence, the sexual urge is suppressed, there is excessive masturbation, or people stay in unhealthy relationships to avoid going without sex. Incomplete coitus used as a contraceptive measure is another source of resisting the sexual urge on the part of men. This can lead to a kind of obstruction of the semen, shukra, shukrashmari, or even impotency in men. For women, incompetent lovers can cause frustration. Ideally, it is best to satisfy this urge within the parameters of a caring and affectionate relationship. Yawning, burping, sneezing, and breathlessness from exertion. These are other urges vague people unknowingly resist because of social pressure and or trying to be proper. Resisting these urges disturbs the natural direction of Vata and can cause many serious health issues, making it difficult for doctors and patients to find these hidden causes. As with the other problems caused by suppressing the urges, vague cause problems, these are treated so as to regain the proper direction of Vata. There are some new phenomena that can be considered suppression of natural tendencies that have come with modern technology. One example is the use of doctor prescribed hormones by women to regulate menstruation. Birth control based on hormones is a very common suppression device. In India, this is done to avoid menses during religious occasions. In the United States, travel or athletics are most often the reason for this manipulation. Women who have gone through modern fertility treatments have this suppression as part of the treatment. Treating menopausal symptoms with hormones is also common despite controversy over its long-term safety. Conventional medicine often relies on the suppression of menses as a way to control excess menstrual bleeding. There are women who are now avoiding their periods altogether with the help of hormone treatments. This has to be considered as suppression or aggravation of the natural menstrual cycle that will lead to a health problems that will lead to health problems in women, but as of yet, it is unclear what the repercussions may be. Use of antiperspirants to suppress the natural sweating process can be seen as the suppression of the natural activities of the body, and it is suspected to have implications on breast cancers. Use of air conditioners which suppress the natural sweating process also should be limited for the same reasons. To summarize, Vata is the force behind all natural urges. Vague. Their suppression or aggravation leads to imbalance of Vata dosh, often requiring treatment to restore balance. It is typical that these important causes of imbalance are not identified.